Who I'll be speaking to in just a moment, has, of course, a couple of activities that are happening in commemorating today, which, of course, is Nurses' Day. So without any further ado, let's get straight to him. I mean, COVID-19 has stretched the country's healthcare resources, and health workers have been the backbone fighting the virus, as well as saving lives. It's been over a year now since the pandemic hit, and this has brought increased fatigue, long shifts, as well as limited resources. And this is set to continue as a third wave coronavirus looms in the country. So today, as we observe International Nurses' Day, honouring those at the forefront during this difficult time is more significant. So our reporters are across the country to unpack the significance of this day and how the country's nurses are coping. We'll start with Manqoba Mchunu, who is in Johannesburg, of course, to give us an update of what's expected there. Manqoba, good morning to you. And today's quite a special day for our nurses, as they are put in the spotlight, celebrated for their efforts, but also equally, they are taking this opportunity to raise some of the concerns that they have in the field.
Indeed, Tumelo, and you'll know that the past 15 months haven't been easy for nurses in the country, given the fact that we've been battling COVID-19. And certainly many of the nurses that I've spoken to are saying that there's very little to celebrate as the nursing fraternity, given the difficulties that they've faced in the past 15 months. You'll know that, of course, there have been quite a number of issues that nurses have raised when it comes to issues of the working conditions that they continue to work under. Just speaking to some of the nurses earlier on, of course, off camera, they told me that one of the issues that continue to be a problem for them is the issue of overcrowding in hospitals, as well as issues of a lack of resources, and also, more importantly, the issues of the fact that up until now, they're saying that they still don't have adequate personal protective equipment to work with when they go to work. And those are some of the concerns, of course, that were raised when this pandemic began. We recall, Tumelo, that this was one of the issues, a major issue that was facing the healthcare sector in the country as COVID-19 really reared its ugly head. But the nurses, however, saying that there is some hope in terms of dealing with COVID-19, in terms of the vaccination itself. We know that the vaccine program has started, but they're saying that there's not quite enough vaccines available at this stage, and there's quite a concern to them, given the fact that many of them up until this day have not been vaccinated. So there are fears, especially around the third wave of coronavirus infections, that many of the nurses could still find themselves in the similar predicaments that they found themselves in during the first and the second wave of coronavirus infections, and the fact that many of them fear that they might be facing again a similar situation where they have to see their colleagues falling sick, and also themselves falling sick, and some of them even dying due to the fact that they believe that the healthcare system simply is not ready enough to deal with the third wave of infection. So we are expecting some events to take place today. I do know that Tinosa will be hosting an annual event where they'll be celebrating the Nurses' Day today. But of course, we are going to be speaking to some of the nurses as well, just to get a sense from them on camera as to what are some of their frustrations and what they believe can still be done to improve the healthcare sector in the country.
Well, of course, with that being said, we understand that in some of the activities that will take place, the theme that they would be recognizing, colleague, is Nurses, a Voice to Lead, a Vision for Future Healthcare. Do we know government involvement in as far as they're concerned with any of today's activities?
Well, what you do know is that the Minister of Health, Zweli Mkhize, is expected to address that event that will be held later on today in Pretoria by Dinosa. And of course, we do expect to hear him speak on some of the concerns and how government is really addressing these concerns. Because, for example, when speaking to one of the nurses earlier on today, she says that the fact that even up until now, there have been no pay increase for nurses in the country, is another indictment in terms of the nursing profession, because they have been in the front line of fighting COVID-19. So it has been quite a difficult year, and the fact that even up until this point there seems to be no sort of recognition from government for the hard work that they've been doing, is something that they really take to heart. And of course, the other issue that they're raising is the fact that up until now, government had made promises about filling some of the posts where there are shortages, but that process is somehow very slow. So these are some of the major concerns that they'll be expecting the Minister of Health to address when it does address that event later on. And certainly we're yet to hear what the Minister himself is going to say with regard to some of these issues that have been raised by some of these healthcare workers.
Absolutely. Manqoba, just on the note of vaccinations, we know that healthcare workers, including nurses, were part of the phase 1 in terms of, being vaccinated. Stats showing us that approximately 400,000 healthcare workers have been vaccinated so far. That indeed is a drop in the ocean. There's still lots more of these healthcare workers that need this jab. What are unions saying? What is the department saying in terms of speediating this process and also assuring that healthcare workers, including nurses, will be given the jab and prioritized in this instance?
Well, Tumelo, the health department saying that, of course, the vaccination program is going to continue. Of course, you recall that there has been some hiccups when it comes to the issue of some of the vaccines that have been acquired here in the country. I speak of AstraZeneca. You recall that that particular vaccine was halted due to some concerns, and also the Johnson & Johnson vaccine itself had some problems and forcing government to really also suspend its use. So government saying that they are hoping to vaccinate as many of these healthcare workers. Of course, you'll know, Tumelo, that they have about 1.2 million healthcare workers who are yet, who need to be vaccinated. But of those, as you've mentioned, only 400,000 of them have been vaccinated. So it's still a bit slow, according to some of these healthcare workers. They believe that, there's still a lot of work that needs to be done in terms of reaching a large number of those healthcare workers. And those are some of the concerns that, they've been raising with regards to the third wave itself, that they feel that they're not adequately protected and that perhaps government could do more to ensure that they speed up the process of vaccinating these healthcare workers. And we're hoping to hear what the health minister will say in terms of the vaccination of healthcare workers when he does address this particular event later on.
All right, colleague, I'm going to leave it there with you, Manqoba Mchunu, in Johannesburg. Let me head over there into Cape Town, where my colleague Nobesutu Hedjana is stationed. Good morning to you, Nobesutu. I know that today is also a focus for you within the city, and it seems, an issue around working conditions continues to loom when we talk about nurses. Issues such as being overworked but understaffed, and these are some of the pre-COVID issues that nurses had. What are you hearing from the ground?
Well, certainly, Tumelo, indeed. And in fact, last year we did speak to DENOSA, the Union for Nurses. They were saying that they've been reaching out to the department asking for vacancies to be filled and saying that nurses are exhausted and overworked. But I'm joined by a retired nurse. It's been 12 days into her retirement, and they always say that always a sister, or rather a nurse, you're always a nurse, whether you retire or not. Sister Walker, can you just tell us about your experience as a nurse? When did you start?
I started in 1975. I started at Grootskea. I'm from the Northern Cape. Then I finished my staff nursing in 1977. Then in 1980. Then I left Western Cape and went to Eastern Cape. There I worked for 3 months, and I came back in 82. And then I started as industrial at Lentegee Hospital, the psychiatry hospital. Then I finished my registered nurse. Then I came to retreat in 2002. And I retired on the 30th of April 2021.
And how has it been for you? What are your most memorable moments working as a nurse?
Where I can save lives, and it was so wonderful when they come back and you can't even remember them, but they come thank you for saving my life. So, in difficult, they all know how difficult conditions we're working, but in my experience, I could save lives.
And what do you think needs to be done now to improve the working conditions that you were talking about?
The staff that must be increased, the equipment that must be in working orders. I mean, we're struggling with that still with the broken equipment that we had to work with.
And what have you been doing since you've retired? I mean, you've been working for over 21 years, so what have you been doing to, to kick back and relax?
Monday I went out to my car license because they keep on now reminding me of my car license. Tuesday, it was yesterday, I said to my husband, let me go a little out, and then we went to go sit by friends, and then here you today.
Okay, and what does Nurses Day means to you?
A lot, I mean. Then you can see all of them and you can hear what they experience and what we want to hear, what is there in the future for us. So we hope what they promise, it will happen.
All right, thank you very much. Well, Tumelo, Sister Walker has been going out with her husband and meeting family members just to kick back and relax because she's been working as a nurse for 21 years. So I think she does deserve that break.
Listen, Nobesutu, she deserves to be pampered. Thank you so much, Nobesutu, for highlighting such stories. My colleagues Nobesutu Hejan in Cape Town and Manqoba Mkhunu in Johannesburg.